Hand arthritis is common in the population, and it really affects all people. It affects people more as they get older, and it affects women more than men. The most common sign of hand arthritis is actually arthritis at the base of the thumb. People don't often recognize it as being arthritis of the thumb, but they will experience problems opening jars and doorknobs. Sometimes their hand will be sensitive or sore when people shake it. That's usually the early sign of arthritis at the base of the thumb. This can usually be well treated in non-operative ways with either a splint or steroid injections, and occasionally surgical procedures, either to clean that joint out or to replace it or to resurface it. There are a lot of options for treating thumb arthritis. That's because it's become so common in the population. Wrist arthritis is also common in the population, particularly in men who have done heavy work over the course of their lifetime. It's associated with swelling at the wrist, occasionally discomfort when you lift heavy objects, and sometimes loss of motion. Wrist arthritis is sometimes easily treated with medications or steroid injections. Occasionally, small procedures to block the pain nerves from the wrist can be very successful in relieving the discomfort of wrist arthritis. More significant procedures are also available with wrist replacement or sometimes wrist fusion, depending on what's appropriate for that patient. If you're experiencing symptoms of pain in the hand that may be hand arthritis, contact our office and we'll obtain the necessary x-rays and imaging to help you establish a diagnosis, figure out what's wrong with your hand, and give you options for how to make it better.